Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. I understand you've been experiencing some troubling symptoms. Could you tell me what's been going on?
Yes, thank you, Dr. Daniel. So, it's been, well, about 4 or 5 months now, and I've been having these persistent issues. At first, I thought it was just a regular cold, maybe some allergies, But it hasn't improved. In fact, I feel it's gotten progressively worse. My nose feels constantly blocked, like, not just congestion, but completely obstructed at times, and I find it almost impossible to breathe through it. And then there's this intense pressure around my face, mostly across my forehead and around my cheekbones. It's like a heavy, dull ache that just doesn't go away. Sometimes, the pain radiates all the way down to my upper jaw, which makes it really hard to eat or even talk for long periods. I also have this strange sensation in my sinuses, almost like a weight pulling downwards. I've noticed my sense of smell and taste are severely diminished, too, which makes food taste bland. It's all just very frustrating and exhausting.
I see. Do you experience these symptoms continuously, or do they come and go?
Well, that's the odd part. It's pretty constant, but sometimes, especially at night, it feels like it intensifies. I've tried lying on the side or propping myself up with pillows, thinking it might help with the congestion, but it only provides minor relief. The blockage seems to worsen when I'm lying down. There's also a lot of mucus, yellowish, thick, and sticky, and occasionally, I feel like there's a bit of blood in it, which really worries me. And I forgot to mention, I also have this nagging cough. It's mostly dry, but occasionally I do cough up some phlegm, especially in the mornings.
Thank you, that's very thorough. Have you tried any treatments or remedies up until now?
Yes, quite a few actually. At first, I tried over-the-counter decongestants like pseudoephedrine. Those didn't do much, honestly. Then I moved on to nasal sprays, saline rinses, you name it. I even tried a corticosteroid spray, which my pharmacist suggested could help with inflammation, but after a few weeks, I didn't notice any improvement. I've also tried steam inhalation with eucalyptus oil to clear my sinuses, and while it does provide some temporary relief, it's short-lived. I even tried some herbal remedies like turmeric and ginger tea, thinking it might reduce inflammation, but again, no luck.
Right, and how about your medical history? Any history of respiratory issues, allergies, or surgeries in the past?
Well, I've had asthma since I was a teenager, but it's generally well controlled with my inhaler. I've never had any surgeries or major illnesses. I do get seasonal allergies, but they usually resolve by the time spring ends. This feels different, though, more persistent and intense. It's also strange because I feel exhausted all the time. I don't know if it's due to the lack of sleep from not being able to breathe properly at night, or if it's part of the condition itself.
Thank you for that. From what you've described, Mihiraa, it sounds like you might have nasal polyps, which are non-cancerous growths in the lining of your sinuses. They can cause symptoms similar to what you've been experiencing.
I've never heard of those.
To confirm this, I'd like to conduct a few examinations. An endoscopy would allow us to visualize any of it directly. Additionally, I may order a CT scan of your sinuses to assess the size and location of any polyps and to examine the extent of any inflammation or blockage.
All right.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Norris Lehman, one of the nurses here. What brings you in today?
Good morning. For a couple of weeks now, I've been having this awful pain in my lower back which radiates down my right leg, and it gets worse when I sit or bend forward. I've also started to feel some numbness in my toes. I thought it might go away on its own, but it's not improving.
I see. That does sound concerning. Could you tell me a bit more about the pain, Mihiraa?
The pain is quite severe, like a sharp, stabbing sensation. I can't sleep properly because it gets worse at night, and I'm struggling to do simple things like standing up from a chair or lifting anything heavy. I work as a teacher, so long standing is becoming unbearable. It's really affecting my life. I just want the pain to stop.
I understand how much this can impact your daily routine. Mihiraa, have you tried any treatments or medications for it so far?
Yes, I've been taking over-the-counter painkillers like ibuprofen and paracetamol, but they only provide temporary relief. I also tried using heat pads and doing some light stretching exercises, but nothing seemed to make a lasting difference.
Alright, have you experienced any similar issues, or is this the first time you've had this kind of problem?
I've had some mild lower back pain before, especially after long days at work, but it's never been this bad. I've also had some neck stiffness off and on over the years, but nothing serious. My overall health is pretty good, but this pain is just too much.
Thank you for sharing that, Mihiraa. Based on your symptoms, it's possible that you might have a herniated disc. The pain you've described, especially the sharp sensation that travels down your leg, along with the numbness, can be signs of this condition. Essentially, it occurs when the cushion between your vertebrae bulges out, pressing on the nerves in the spine.
Oh, that sounds serious. Is it something that can be treated easily?
Mihiraa, in many cases, this can be managed effectively with the right treatment. First, though, we'll need to confirm the diagnosis with some tests. I'd recommend starting with an MRI, which will give us a clear image of your spine and show whether a disc is pressing on your nerves. We might also conduct a physical exam to check your range of motion and see if certain movements trigger the pain.
Okay, that sounds reasonable. What kind of treatment would I need if it is a herniated disc?
Depending on the severity, treatment can range from conservative methods like physical therapy and medications to more advanced options. For instance, a physiotherapist can guide you through exercises to strengthen the muscles around your spine and improve your posture, which can relieve pressure on the affected disc. Anti-inflammatory medications like naproxen or stronger pain relievers can help reduce inflammation and manage the pain. In some cases, corticosteroid injections might be necessary to decrease swelling around the nerves.
That's good to know. Are there any risks I should be aware of?
For the most part, the treatments I've mentioned are safe, Mihiraa. Medications can have side effects, such as gastrointestinal issues with long-term use of anti-inflammatories, but we'll monitor that closely. As for corticosteroid injections, there's a small risk of infection or worsening pain, but complications are rare.
I appreciate the information. It's good to know what to expect.
You're welcome, Mihiraa. We'll get you on the path to feeling better soon.